Hey guys, we'll get started here shortly. Okay, there we go.
All
Hello
right.
and welcome to episode 7 of SnackBreak by OrthoSnacks. I'm your host, John Schaefer, and on this podcast we interview physical therapists, fitness professionals, and health and wellness experts. My guest today, all the way from New York, he has his training from the University of Delaware, both his undergraduate degree as well as completion of his sports residency in 2019. He's had the opportunity to work with NBA G League's Delaware Bluecoats, and he has so many certifications, he can hardly fit them in his Instagram bio. His current projects include working in content creation with the prehab guys, as well as transitioning to doing a lot of ACL training online and kind of bridging and filling the gaps where he sees those are currently present. Without further ado, my guest today, Tommy Mandala.
Happy to be here. How you doing, John?
Good. So I'd like to kind of start our conversation by taking you back to your residency training. And I guess one of the things that I'm most curious about is how did you choose between the sports residency and orthopedic residency? I know that's a question a lot of people kind of go back and forth with as they're deciding whether or not to choose a residency.
Yeah, so that's a great question. And what I would say first is not every residency is the same, and not every residency experience is the same. And I can't recommend enough the residency that I did do at the University of Delaware. And one of my mentors there was actually the head of the residency special interest group. Her name's Ariel Giordano, and she was just made it such an incredible experience for me and all the other residents there, both in the orthopedic and the sports residency there. As far as choosing between the two, what I will say is that doing a sports residency allows you to then sit for your SCS. Whereas if you're not an athletic trainer and you don't have an opportunity for field hours outside of residency, it's going to be very hard for you to get the requisite field hours to then sit for your SCS. So in my case, I knew that I wanted to pursue both my SCS and my OCS. So I jumped for that, and I wasn't an athletic trainer. I was an exercise physiology major in undergrad. So I wanted that on the field experience, which I got working with Delaware teams as well as the G League, as you mentioned. Was able to sit for my SCS and then subsequently the OCS. But I think for a lot of people who are athletic trainers and have that on the field experience already, I think the OCS might be a better route, and you could still have the opportunity to sit for both if that was something that you wanted to do.
Okay, awesome. And then, so I guess another question I have then is, so I see that you got your CSCS a while ago too. What are the biggest differences between the CSCS and the SCS in terms of someone who already has one but maybe isn't sure if, pursuing a CSCS or
Yes.
SCS is worth it?
Yeah, it's a lot of S's.
Mouthful.
No, it could be confusing. And honestly, I think one big initiative that we as a profession are trying to do is to make those more relevant, more known in the community and even outside of the community. Because I think physical therapists know what an SCS is and how difficult it is to get that. But as patients and clients often don't really know the difference in those things. The CSCS is the gold standard in terms of strength conditioning and personal training. And it is a rigorous test, and you need a college degree for it. The SCS, though, is an even higher level. To sit for the SCS, you have to have gone through undergrad, gone through PT school, and then either been residency trained or accumulated enough mentored hours and on-field hours to be able to then sit for the test. So the SCS is a little more of a board specialty, almost the way that you would get as a physician.
So do you have any recommendations in terms of, I guess, communicating that value to your patients, or is that not necessarily something that you think is appropriate? It's more through your actions than anything you would say.
Yeah, so that's a great question. I think that's a great initiative for us as a profession. And I think the APTA is trying to do that. They're actually trying to get away from saying SCS, they're trying to get more towards saying board certified specialist in sports. So I think that's a great initiative for the profession, and I think we should absolutely do that. But I don't feel it incumbent upon me to educate individual patients. You know how hard I had to work for these letters. So I don't think that's, because I think it shows, in the experience you can give a patient, and hopefully they're able to see that.
Okay, yeah, that makes sense. think I meant more in terms of if there's any way you can market yourself a little bit with that in a way that's not so in your face.
Yeah.
Kind of like you're saying,
No, that's
but
a
yeah.
great question. I think one thing we figured out is that, or that I've seen, especially with the rise in social media and things like that, is that patients really care more about what you can do for them and the outcomes you're going to help them achieve, more so than, letters and things that we as clinicians often care about.
Yeah, absolutely. So I guess my next question then is, following the residency, what was your initial plan?
Yeah, so I had one goal in mind. Being from New York City, I'd always wanted to work at the hospital for special surgery, which is top orthopedic hospital in the country in New York City. And I was fortunate enough to step into that role at the hospital for special surgery. And I had an incredible experience, and it really was, my dream job. And I worked there, for a good period of time and then this kind of just took off, leading me to take this all on ACL business full time.
Sure. So maybe for those who aren't as familiar with the hospital, what's the typical population you're working with? Is it more athletes or what's?
Yeah, so Hospital for Special Surgery is a standalone hospital in New York City that's exclusively orthopedic surgery. And they have different services. They have a sports service and an orthopedic, an arthroplasty service, those being the two main ones, and then different subspecialties beyond that. And what's really cool about it there is that they have different PT clinics. So one PT clinic that gets specifically referrals from the arthroplasty or joint replacement doctors, and then one clinic that gets, specifically from the sports service. So the clinic I was in was working with the sports service, and got to see a lot of doctors who specialize in ACL surgeries, and got a lot of experience seeing just, a ton of surgical knees that would take, most clinicians years and years to accumulate. We got to see, over the course of weeks and months.
Yeah, I think that's something that's been a little bit bizarre for me too, is through my first 20 weeks of clinic, I've only seen one ACL repair.
Wow.
So it's not something I have a lot of hands-on experience with, and that's why I think it's cool that you can follow people on social media and things like that, to get, a little bit of that experience. But so I guess, when did you first realize, that the ACL was the part of the body that interests you the most, that you're going to have the biggest impact?
Yeah, so it was funny because my experience kind of built that. So I'd always had an interest in knees. My father had a lot of knee problems, and he always tells this story that he had surgery. It wasn't an ACL, but it was a meniscus surgery. And when he woke up from the surgery, they told him, "Oh, we'll get you back to like a somewhat normal life." And he was like, this jacked, like 30-year-old firefighter who was like, "What do you mean somewhat normal life?" And he was like, wasn't sure, he was really struggling with his knee after that, until he finally found, it was actually a doctor, not a physical therapist, who told him, like, no matter what you do, you have to build up your quads, and you really have to, hit that knee extension machine and slowly, progressively overload, build up your quads. And it like totally changed his life. If it's like a butterfly flaps its wings. If he hadn't had that guidance, he was able to, continue working out the rest of his life, and still is working out, hard to this day. And I just saw what an impact that made, having the right guidance. And then I was fortunate enough to learn at the University of Delaware, which really specializes in ACL rehab and has some of the top producers of ACL rehab research in Dr. Snyder Mackler and Ariel Giordano, who I mentioned, as well as a lot of other people who've gone through there. And it was cool for me to see the research kind of confirm my pre-existing biases, that strength really solves a lot of problems. And learning that and seeing it, and then having the opportunity to be at different places like HSS, and then previously at Champion Sports Medicine in Alabama, where we had a biodex and we were testing other people's patients from all over the world,
Cool.
or at least they're all over the area. I got to really see how, just how much that hadn't trickled out into the population, and how many ACL patients really weren't getting the care they needed, and weren't getting the progressions they need, or that expert guidance. Like you said, it's very hard to treat an ACL if you only see one a year, and you're in your final rotations. So it could be really hard if you don't have experience with that. And, I was fortunate enough to start working with prehab, and, had opportunities to write blogs and go on podcasts with those guys. And every time I did, I always found myself just, talking about ACL rehab. It would just always kind of come up. They would be like, what do you want to write about? I'd be like, can I talk about this different topic, with ACLs? And then I was on, some of their podcasts, and had a couple of people reach out to me asking more questions about it. And it just kind of got my wheels turning about, how much this was really missed.
Sure. So how did that relationship kind of start for you with the prehab connection?
So it was pretty crazy. I think they posted something way back when about I can't remember. They posted a job posting that was like a job I didn't want, but it was like something that was like, I don't know, something that wasn't that interesting to me, but I was like, oh, these guys are cool. It was like during the pandemic, I had a lot of time. So I applied for it and reached out, and I interviewed with Mike, and I talked to him for a while and was pretty honest with him, and he was super cool. And at the end of the interview, he was like, dude, you sound like super passionate about, producing content and things like that. Would you be more interested in a role like that? And I was like, oh, that's exactly what I'd like to do. That's way more up my alley. And they gave me an opportunity. I wrote a few things for them that they liked, and I've been, continuing to produce content for them since.
That's awesome. Yeah, I feel like the more conversations you have with genuine people, the more you kind of understand, what you want, what your goals are. So that's awesome. I guess we can kind of go off that then. So one of the, bigger, more known articles that I've seen several times on the Prehab's website that you've written is "What's Missing in ACL Rehab." So for those who haven't read the article, could you give a short summary, maybe what you think the biggest components are and why those are getting missed by clinicians?
Yeah. So, and I want to be clear. You're really looking at the article. It's one of the biggest things is first not what's missed by clinicians, right? Because my initial, what I felt like I identified, and not just me, other people, we would always talk about it. Colleagues of mine who saw a lot of ACLs, we would talk about, just the progression in the clinic almost doesn't make sense, right? Like we tell people, you're supposed to have, this should be a 9 to 12 month rehab, right? And in an ideal circumstance, you get someone at, 80 to 90% quad strength at, 3-4 months. You take them through running, jumping, cutting, all of those progressions. Well, you're not going to let them go back to sport for 9 to 12 months, right? Most people with insurance-based care run out of insurance visits in 4, 5, 6 months, right? And then even beyond that, people who don't run out, our options are to say, well, they probably don't need to come into the clinic twice a week, but they do need us to progress them and guide them. So, maybe you have them come in once a month, and you'll try and program out for them over the course of that next month. And I found even with my own clients, when I was in the clinic, it was really hard for something not to happen in that month, where you would program out for them in a month, and inevitably life gets in the way. They'd fall off for a minute, they'd lose motivation, they'd go on a vacation, or they'd, I'd be like, this was bothering me, so I stopped doing it. I wasn't sure what to do. And I was like, this is really just not that great of a system. There's got to be a better way for us to fill that gap, even if someone gets awesome rehab from month 1 to 4, to how do we get them then from month 4 to 12 and successfully get back on the field. And one thing I do want to say is that when it's high school and college athletes, if you have, athletic trainers and strength and conditioning
Mm-hmm.
specialists that you work closely with, they absolutely can fill that role. But the reality is for, most, people who are past that point, anyone who's pretty much 24 and older, that, I don't really, no one seemed to be able to verbalize to me what the solution was for them. So I do want to say that, that what's missing in ACL rehab is really something that's missing in kind of the system itself. But research wise, you are right that, it's unfortunate to say, and I don't want to say this as a knock on our profession, but there is a lot of, up-to-date research that we have for ACL rehab and care and best practices that are not being implemented. So we know that the best criteria for return to sport is quad strength greater than 90%. We know that's the number one predictor of re-injury. We know that you can decrease your risk, that every 1% increase in quad strength relative to your uninvolved side decreases your risk by, I believe it was 3% within like 2 years, which is just an astronomical stat. And yet we still see that only 60% of ACL patients achieved that return to sport goal of greater than 90% quad symmetry at 2 years post-op. So there's just this mismatch between what's happening out in the population and what we know to be best practice.
Yeah, those are all great points. Something I guess I'm pretty curious about just from some of the research I've done. I had mentioned I did an in-service where I used a lot of information from both your Instagram account as well as things you've written. But just in terms of practicality for the best way to take some of those objective measurements for patients who are looking to return to sport following ACL injury, I know you can use things like force plates if you want to measure the rate of force production. But I mean, those are super expensive. And the more we're seeing with manual muscle testing and possible inconsistencies, especially across clinicians, what's the best way to get objective data when you're measuring quad strength for these patients?
Yeah, so that was a super diplomatic way of saying possible inconsistencies. Yeah, so I'll be more blunt. The reality is kicking into someone's hand with your quads. No one can tell. Like we know from, I think there's a great distinction to be made in the difference of like we have evidence for something. We don't have evidence for something yet, and we have evidence against it, right? We have really good evidence that there's really no consistency to manual muscle testing. It's standardized, but there's no consistency to it, and there's no real way that you should be able to tell if, with how strong someone's quad needs to be, those minute differences of even up to 20, 40, 50%. Everyone's quad should be stronger than your arm. But you're absolutely right. There's a lot of awesome technology out there. And of course, the Biodex is still the gold standard. And things like force plates and different systems that are evolving, and the research is evolving to show their usefulness to us, is really helpful. But just basic, something as simple as 1 rep max testing on a knee extension machine, which there's a paper by actually a former Delaware resident, shout out to Anthony Sinacor, who published that paper correlating that to the gold standard. And it's not a perfect correlation, but considering the Biodex is, a $36,000 machine that very few people have access to, at least that 1 rep max testing is giving you really, a solid correlation and certainly a baseline. And that's, I think sometimes we worry too much about the decorations or like the hood ornaments, looking at force plates, and we talk so much about these higher level things, but we know that, simple decision rules can reduce your risk of ACL re-tear by 84%. So one of the things I really tried to highlight in that blog is like, we as clinicians are often not doing the basics. Like there's evidence out there for these simple things that we're just simply missing. Even and force plates and all of that stuff are great, but we need to really nail down the foundational stuff, and that stuff is on top of it.
And then, so I guess kind of a follow-up question to that would be, if you're doing a lot of training for patients and athletes online, how are you measuring, objectively whether or not they're making progress? What are some of the things that you found to be helpful?
Yeah, so I mean, first off, just tracking their strength, right? There's a lot we could do with video analysis now as well, and then just tracking their strength on the different machines they use, and then finally, I do use that one rep max testing and find it to be extremely helpful in guiding our progression, and I use it, the way that we correlate it in that paper to success with running and return to sport.
Okay, awesome. And then, so I guess I'd kind of like to transition more towards what you're doing online now. So I always like to do a deep dive on whoever I'm going to interview. And so it looks like April 18th came along and you switched your Instagram handle, no longer Tommy Mandala, and you've transitioned to this all in ACL. What were you kind of thinking at that point in time? Did you have any idea it was going to become what it is now? And kind of, I guess, what were your goals at the time?
Yeah, so that's a great question and a great catch. Yeah, April, it has evolved, yeah, like crazy, insanely quickly. And so I gotta say, I did believe in it. I really did think, I did think that this was a need out there and a problem that I didn't see a solution for that existed for these patients. And I felt like I could create a solution for people who didn't have one. So I did believe in it and I really did think it would work. That being said, and that's kind of why I called it all in ACL, because I felt like it was, for me, a mental thing where I really was kind of going all in on it. And it's scary to officially kind of like change your Instagram and be like, all right, I'm putting myself out there. But I never thought it would explode kind of the way it did. I think I really did create this with the idea that for patients who had awesome rehab, and I looked at the flaws in the American system, right? That's one thing, that there's flaws in our insurance-based system, but you see a lot of countries that have socialized medicine, where I have clients in the UK who get physio once every 2 weeks. And that's just not enough. It's just, it's not going to work. I don't understand how they can cover a surgery and then not give them what's necessary to help them do that. And so, yeah, and starting it to bridge the gap for people who had awesome care, and then kind of seeing that, talking to so many different ACLs from all around the country, I was like, wow, there's really a lot of, poor care being given out there by people who don't see this injury often enough. And inexperienced, ACL treatment that can lead to some disastrous results. And I've been fortunate to have an audience and attract more clients than I expected this quickly. And it's allowed me to kind of take this full time and continue to expand it.
Yes. And so it sounds like over this last month, you've kind of went all in. You're no longer putting in any time in clinic. This is the main show. So what's your current caseload, or what's the goal in terms of the ideal amount of patients to see on this more of a virtual setting?
Yeah, so that's a great question. Right now I'm upwards of, I'm floating, close to 40, 50 clients that I work with, all ACLers. So really kind of gives me, even more of an insight into these patients than I felt like I had previously, just because I get to kind of, and at one time I'm working with that many ACLers, but I'm also talking to, hundreds, a day, just kind of back and forth on Instagram, just hearing from them. But, honestly, I want to continue to grow this just as to help continue to meet people's needs. So, whether I haven't put together really my vision for continuing to expand this, but it's getting close to, at some point where I'll look to more fully expand this. But I feel like it's I'm able to continue to help people. So I want to keep bringing as many people on that I can fit onto my caseload.
That's awesome. So is there any kind of consistency to your weeks, or is it kind of all over the place, helping people as you can?
Yeah, so that's a great question, and something I'm learning a ton about over this last month.
Mm-hmm.
So I had like a soft entry into I had a soft entry into not working in the clinic full time, because as soon as I
Mm-hmm.
left the clinic, and that was almost easy, right? Because I was in the clinic, I only had so few hours outside the clinic that I just had
Mm-hmm.
to, I didn't really have to do much of my schedule. I just crammed every second. I crammed all in ACL stuff into
Mm-hmm.
every waking second I had outside of work. But then when I finished, I actually had an opportunity to go on tour with a musician. So that kind of was a little bit extended my working experience a little more, where I was still able to do this remotely, but was kind of working with them for a bit. So I'm just kind of getting used to planning my weeks and creating that. So
Mm-hmm.
I'm trying to create more of a consistent schedule, but I would say I just kind of got it down, I would say this week, honestly.
Okay. You just kind of dropped that you traveled with a musician. What was that all about?
Yeah, so I guess I could say this because I posted it,
Yeah.
on my Instagram. I had the opportunity to go on tour with Willie Nelson for a bit, which was
Oh,
a
wow.
pretty incredible experience. He was the nicest guy, and I just got to work with him and his family, ride
Mm-hmm.
the bus with them, go to his shows, which were incredible. And yeah, it was just a blessing, and right timing, that as I was getting, leaving the clinic and going full time with this, I had the opportunity to do that, and was put in touch with them, and got to do that while I was able to run this business. So it was a really cool experience.
That's awesome. Um, yeah, so I guess my last kind of question, just about all in ACL. Um, what kind of advice or recommendation would you have for someone who's considering transitioning or doing some more virtual online training in the future?
Yeah, so what I would say is to master, like, figure out, what you are really good at and passionate
Hmm.
about. Because if you have a unique skill set and a unique passion, I think combining those can really help it, explode in a way that it wouldn't otherwise. So, I think making sure that there's, something you can give to people, that they
Hmm.
really need, and something that you feel like is missing out there, that you're passionate about. I think are really the two keys.
Awesome. And then I guess I'll just look at my notes, and I had one other question just about, again, all in ACL. So I guess what's the biggest challenge that you've come across so far since you transitioned more of the online?
Honestly, what you just talked about earlier with scheduling,
Okay.
like starting with like a blank, like looking at my week and starting with like a blank slate and being like, I could not work, I could work, like it's like kind of a crazy thing to be just
Hmm.
in charge of your own schedule. And it's almost like enough freedom to drive you crazy.
Yeah.
So it's kind of funny because you think, leaving the clinic and working for yourself is like going to be, like, oh, I'll have the freedom and flexibility to do whatever I want. But you realize that for it to really work, you have to kind of not give yourself
Yep.
the freedom and flexibility. So I'm probably a tougher boss on myself than I've had before
Hmm.
that.
All right. Tommy, I've got 5 questions I asked all my guests. Are you up for answering them?
Yeah, absolutely.
Awesome. So my first question is, what is your biggest key to a successful day?
Uh, my biggest key to a successful day, aside from what I just said about making sure it's planned,
Hmm.
I would say working out in the morning. I've tried to like work out in the afternoon, but it's just really hard to get my day going without having my
Hmm.
workout behind me.
What's the ideal time for you?
Wake up at 6, go to the gym at like 6:45.
Okay, nice. Yeah, it's nice to kind of knock it out of the way at the beginning of the day, and you feel like you got something done and kind of have that momentum. I like it.
For
Um,
sure.
my next question is, what's something you wish someone would have told you 5 years ago that might have made a big impact at the time?
Invest in Pfizer. No, but 5 years ago, that would have made a big impact. I think just that like things are like things aren't gonna go according to plan, but it's gonna be like a better plan than you could expect. I think, realizing that like if you work hard, that like different opportunities will arise. Because that's one thing that you asked about residency earlier. Most of the residencies agree to inform you that you've been accepted on the same day, and they pretty much give you one day to accept. So I was like living in New York and found out at like midnight that, I'd been accepted to a residency in Boston and a residency in Delaware, and had like 12 hours to make a decision. And, I had a long-term girlfriend who was living in Pennsylvania, and I was like, that was a lot of stress to figure out. So that's something to keep in mind as you're applying to residencies. But just that it's going to be, things won't always go according to plan, but they'll probably work out for the best.
Awesome. Yeah, I like that a lot. I think a lot of times, especially PT students, are very, very organized, plan, like things to go a certain way. It's just having that flexibility, I think, is very important. My next question is there any book or product that you've encountered, used over the last 3 months that you'd like to recommend or has been beneficial for you?
Yeah, so I feel like if you talk to enough PTs, you probably had a lot of them say Atomic Habits. So I'm not going to say that, although that is a good one. I would say Range by David Epstein. It's called Range: Why Generalists Succeed in an Increasingly Specialized World. And it's all about how, like, basically having a multitude of skills can really help you to find success, even though we've continued to like niche down, which I know it's funny I'm talking about it because ACL niche.
Big niche guy.
I feel like there's a lot of, something like this, success with something like this really requires a lot from you in terms of, communication skills, written skills, empathy, organization, and just creativity on top of that, like scientific, specific knowledge.
Yeah, because I mean, I feel like you can have that one skill, but there's so many other components surrounding it that need to be in play in order for it to be successful. So is there any quote or mantra that you live your life by?
Yeah, my high school yearbook quote was a Mark Twain quote that said, 20 years from now, you'll regret the things you didn't do more than the things you did do, which I try to remember.
Yeah, nice. And then last question, signature question of the podcast, Tommy Mandala, what is your favorite snack?
That's a tough one. You told me that, and I was like, I don't know what, I don't have like any super good one, but I'll shout out, brownie brittle if you've never had that.
Okay.
Brownie brittle is the truth. I would strongly recommend it.
Where can I find it?
Ooh, that's a good question. I feel like it's most anywhere. It's just like any grocery store you go to, brownie. It's like in the snack aisle, like near chips or stuff like that. But
I'll add it to my list. Well, Tommy, thanks so much for coming on the show today. Where can people find you if they want to follow on your journey?
Yeah, so they could find me on Instagram at all in ACL. I'm in the process of getting a little more official and making a real website and things like that. So look for that down the road. But as well as any blogs and podcasts I'm on there are often with the Prehab guys on the Prehab website. So you can check them out as well. But right now, for the most part, just find me on Instagram.
All right, awesome. Really appreciate you taking the time to talk with me today. And thank you everyone for tuning in if you're watching this live or catching it later.
Yeah, absolutely. Thanks a lot, John. Really enjoyed it.
Yep. We'll talk to you later. Bye.
Have a good one.